Welcome to Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our goal is to provide a platform where we can educate, advocate, and inspire women leaders to lift as they rise. With every episode, you'll hear from her as we showcase the perspectives, insights, and experiences of women who are leading the way in advancing women's health and empowering the next generation of women in healthcare.
Hi, my name is Stacy, and I am here today with two incredible women, Dr. Shika Jain, who is the president and CEO founder of the nonprofit Women in Medicine and the founder and chair of the Women in Medicine Summit coming up this next September. Be sure to put that on your calendar. And joining her is the fabulous Dr. Darylyn Moyer, who is the executive vice president and CEO of the executive office of the American College of Physicians. I want to welcome you both here. We are here today to talk about the power of online and social communities. So before we dig into that topic, I would love to know how the two of your paths crossed.
Oh, that's such a great question. And Darylyn, I'm going to refer to you by first name if that's okay, since we go way back.
Absolutely.
So Darylyn and I, and correct me if I'm wrong, I think we first crossed paths when I invited you to speak at the summit. And I can't even tell you how inspiring and how amazing her talk was. And ever since then, I've relied on her as a mentor and somebody who every now and then I can text and say, I don't know what I'm doing in my life. Please help guide me. And she has always come through. She's introduced me to some amazing people, and she has mentored me in many ways. And she has provided insight and guidance as an incredible leader in the healthcare space for so many years. And I am just so happy that she agreed to speak at the summit all those years ago, because it's led to so many wonderful opportunities for us to connect and socialize and engage with each other, and also expanded my circles quite a bit and my network beyond what I thought would have been possible if you'd asked me 5-10 years ago.
I was going to say that Shika and I are different generations of the same group, the women physician professional disruptors. And although she considers me a mentor, I also consider her a mentor. And, as I've gotten up in years, I'm now a PGY 39, I realize that I get so much more from all of those folks in the network than I could ever possibly give back. And for that, I'm really grateful. I think we may have had our first face-to-face meeting in Chicago right before the ACP meeting in 2019. I think that was the first time we met in 3D. And we've been also we're part of the founders of the GEMS Alliance, which is the Gender Equity and Academic Medicine and Science Alliance. Thank you for inviting me today.
Yeah, wow. Well, I'm curious, since we're talking about online and social communities, what was the driving force for you both to either tap into it or start using that medium? Who would like to go first?
I can start with, it's interesting, actually. I was never expecting myself to be somebody who did anything on social media or online connection. I used to make fun of Instagram and Twitter. And then I started writing op-eds and publishing. And the hospital I was working at actually suggested that I start using Twitter as a way to engage and get my research and get my op-eds out there. And so that is how I kind of found myself in the online social media, social networking space. My brother makes fun of me. He actually made fun of me when I put my first tweet out, because he was on Twitter and I was very proud of my first tweet. And he called me and he said, "You are too old to be on Twitter because you just sent a tweet and the only one who can see it is me because of the way you formatted it." And so that was my first foray into Twitter. But I will say since then that I've learned a lot about the power of the communities that we found through these types of platforms, especially during the pandemic. Both the women in medicine community and the fighting misinformation communities really use social networking and social media to really galvanize support and to partner with grassroots organizations in the community to really drive change during the pandemic. I founded another nonprofit during the pandemic called Impact with several other physicians across Illinois. And we were able to not only mobilize vaccinations and confront misinformation in the social media space, we also were able to provide each other support, both mental support, support online when one of us was getting attacked. We actually published many academic papers on the work that we've done. And between Women in Medicine and Impact, I found that the power in these communities and in this kind of third space that we don't usually live in is really phenomenal. And we've also found that it can actually help women in medicine promote themselves and promote their own work, promote each other, amplify each other. In a healthcare system that is so hierarchical, sometimes it's really good to have your own cheerleaders out there giving you kudos in a public forum. And those types of social networking spaces like social media, like Twitter and Instagram, can be a wonderful place for us to amplify and lift up others as well.
Darylyn, how about you?
I just wanted to add that I felt, as when I first went on to social media from a professional perspective, when I was the internal medicine residency program director in my prior life, I felt it was important because it really allowed a democratization of information. It allowed medical students to reach out to, people who were deans, et cetera. And I really wanted my finger on the pulse of what was going on, and felt that it was just a wonderful way to connect and to really make incredible professional affiliations, to ask for help, but to also in turn give help to people who would reach out via direct message or other mechanisms. And it is a really supportive community. I like to talk about the phenomenon of ottering, which is when the female otters all link their arms and form an impenetrable barrier. And I'm so grateful to Shika and her colleagues to creating the Impact for Healthcare with those really critical social media toolkits to assist us when maybe the reactions that we're getting, just some of the things we're saying or posting, is not as positive as we would hope that it would be.
So you talked about networking and collaboration and raising each other up and sending, getting things for problem solving. What would you say surprised you the most about social media and being in online communities? Good or bad?
I think for me, it is how incredibly generous people are with the access to them, the time that they'll give you, and the follow-up. I mean, this is the real deal. This isn't just sort of, putting lipstick on something. It is really deep down, very connecting. And I think it's just been, most of the time, it's an incredibly positive experience. I think, once in a while, we need to do our digital detox and go off the social media for a little bit now and then to come back recharged and refreshed. Shika?
I agree with that 100%. And I also will say the support is it's something that I never expected. My husband doesn't really do social media, so he doesn't always understand this concept of digital support or virtual support. But I'll give this example of when at one point in the pandemic, I put out a funny tweet about how I had accidentally put my pants on backwards and I was doing everything from home that day. And so I said, share, something that is a positive reason for why you're working from home. And I started getting attacked by a conservative radio station here in Illinois. And I didn't think much of it because, when you put things out there, I'd been posting about vaccines and posting about masking. And so I'd been seeing the trolls, but all of a sudden, this entire network of physicians and nurses and patients and all of these people came to my aid on Twitter and started responding saying, Dr. Jane is such a valued member of the community. And do you know who you're talking to? She's been advocating for all of you. Like, you shouldn't be attacking her. And I didn't have to say anything. All of these people came to my aid, which we know that there are trolls out there. It's like you don't read the comment section when you post something because a lot of times there can be a lot of negativity. But to see all of these people from around the country, many of whom did not know me personally, they only knew what I had been putting out on social media, to come to my aid and defend me in such a way, it really felt like a powerful community that I did not know existed. And activating those types of communities is it's such a wonderful ability to be able to also get evidence-based information out there. We created something called Twitter amplifiers during the pandemic, where if we put out an article that we really wanted to get a lot of eyes on, we would post it in our private messaging group and say, hey, I just posted this. Would you mind amplifying it? Or if somebody was getting attacked, we would say, hey, so-and-so is getting attacked for this recent news article. Can we all go and share just evidence-based information to try to counteract some of the negativity that's coming at this individual? And so you're absolutely right, Darylyn, you need digital detox, because sometimes that can get a bit overwhelming, the negative parts of things, which I was never expecting when I went on. I didn't think enough people would really read any of my posts to ever warrant any negativity. But it happens whether you have 5 followers or 10,000 followers. And so having those communities and those amplifiers and those people, some of whom I may never meet in real life, but knowing that they are reading what I'm saying and they are listening. And in some senses, it's actually helping people make educated, informed medical decisions. It really is such a wonderful community to be a part of.
Wow. Well, I also hear that the two of you are taking this to the next level with a collaboration on Lean In. Can you share with us a little bit about that?
I can start talking a little bit about that. So, Women in Medicine partnered with leanin.org last year. We realized that one of the challenges for women in medicine are these silos that exist within healthcare. And so, one of the things after the Women in Medicine Summit, many individuals had told me was, we really want to create a space where we can continue to have these conversations. How do we continue to have these networks? How do we continue connecting with each other after just this one conference? And so we connected with the Lean In organization, and they said there are no Lean In circles for frontline healthcare workers. So we said, great, we can help with that. And so Women in Medicine started some Lean In circles last year. And then I reached out to Darylyn and said, is this something the American College of Physicians may be interested in partnering with us on? And luckily for us, Darylyn is also of a similar mindset of mine, where she feels that these networks are so incredibly important. And so we were able to launch Lean In Circles, and now we are launching, in collaboration with the American College of Physicians, some circles that the ACP will be able to kind of curate and host across the country as well.
Yeah, we're really looking forward to this collaboration. And ACP has a great platform to help to amplify and really expand these types of conversations. We're an organization of 161,000 internal medicine trainees, physicians, medical students around the world. We're, in fact, the world's largest professional specialty physician society. We have about 70 chapters in the US and about 20 internationally. And, everyone is a member for a different reason, whether it's medical education, whether it's advocacy and public policy, whether it's career and leadership opportunities. But one of the big things that we've heard from our groups, seen in our surveys, is that people really need these types of groups for support. It's hard enough being a professional in healthcare. It's even harder when you're a woman. And to be able to support each other simply by listening and having a welcoming, friendly audience, we think is critical to career development. It's also, it helps to make for resiliency and to armor you up against burnout. And it really helps to have others be able to hear what you're saying, or to hear that others are going through the same thing that you're going through, and talk to people who might have some advice for how to get to the other side. So I'm really excited about it. We're doing the pilot with several of our chapters. And I think it's going to be a smashing success, because what we're hearing from the internal medicine community is that they need these types of connections and networks.
For those listening who may not have ever joined or heard of leanin.org, is there a requirement? How could they access this? How could they also participate?
So Lean In is a wonderful organization that not only provides us with the structure for these types of circles, but they also provide us with content. And so if anyone is interested, you can lead a circle or you can join a circle. So Women in Medicine has launched several, I don't know how many we're at now, 30 or 40 circles that we're at now. And those circles are all led by different individuals who want to be leaders. And the really cool thing is this, especially for women physicians who often don't get tapped on the shoulder for leadership opportunities when they are exceptionally qualified. This is a great way to have a leadership opportunity where you get to drive the boat and you get to do it with very structured outlines that Lean In provides. If you want to go off book and you want to use those as just kind of a suggestion, you can do that as well. And this circle can be anything related to, if you want to talk about being a physician parent, you want to create a circle around that. If you want to create a circle about being in a mid-career kind of slump where you're trying to figure out how to get to the next level, you can create a circle around that. And the way to get involved is you just reach out to us and say, I'm interested in either joining a circle or leading a circle, and we'll send you all the information. It's very simple to do.
Wonderful. Well, I am so thrilled with this collaboration that the two of you have embarked on. Where is this going to end up? Where's the future going, do you think, for social media and for online communities?
So I'll say, before I tell you where the future is going, I'll tell you one other online community network that we are creating through Women in Medicine that is separate from Lean In Circles, but it's an even larger expansion of kind of these online communities. We're launching the first ever Women in Medicine community online, virtual community online. And the hope is that we'll be able to bring all of these different women in all different specialties together to have different conversations in different spaces within this online networking community. I think social networking communities, these virtual online communities, are here to stay. I don't see them going away anytime soon. I do see them evolving. I think that especially with what we've seen recently with Twitter becoming X and having new ownership, there's been a lot of questions as to what is going to happen to that community. And I think the future is unclear as to what is going to happen with that specific platform. But I think that there's a lot to be said for all of the different communities that are out there. And I know that Women in Medicine are resilient to the nth degree. So I know that no matter what, we will find numerous different places for us to connect. And hopefully this Lean In collaboration with ACP and Women in Medicine will be the first of many where we can break out of our silos and find ways to really help women use these online platforms in a way that will help advance their careers and also help them find communities of support and safe spaces.
Yeah, I think it's only going to be amplified and really escalate from here. And I think, part of that is the reason that women and people of color frequently they aren't welcomed into traditional networks, or they don't feel like they can reach into those networks. And this is a sort of on-demand kind of networking mentorship opportunity for folks that they can do on their time. They don't have to be somewhere to be at a 7 a.m. meeting when they have to drop their kids off at daycare, et cetera. So I think I'm very excited. I think it's going to be incredibly successful. And I'm really hopeful now that we're seeing staggering rates of brownout, burnout, and professional dissatisfaction, that we'll be able to pull some people back and to really help them with that as they build their network, build relationships, because we know that that's much of the antidote to the phenomenon of brownout, burnout, and dissatisfaction that we're seeing.
And I'll add one thing to that. So Dr. Vinny Aurora, a very, very dear friend of mine, and Darylyn's as well, we founded the other nonprofit I mentioned, Impact Together, over the pandemic with several colleagues. And the one thing she and I always commiserate on is that there are so many meetings and so many spaces where you have to be on video, you have to be on audio, you have to be available. And we have young children who are running around in the background, or we have, conflicting meetings. And so it's not always possible for us to be available for a lot of the opportunities that sometimes are required to really advance your career. And so the flexibility of having something like social media where you can put up a post when you have time, you can engage when you have time, you can amplify others when you have time, and you can be tweeting while you're making breakfast for your children. I wrote an entire Facebook post that turned into an op-ed that I literally talked to text into my phone and then sent to Vinny and said, "This is my post." And she said, "Great, let's turn it into an op-ed." And I did that while making pancakes for my kids in the morning. So I think that there's a lot to be said for the flexibility that comes along with these types of platforms and these types of opportunities that really can be leveraged to help those of us who may not be doing work during traditional times all the time. I can't be doing a webinar at midnight, but I can be tweeting at midnight. Not that I recommend either. You should be sleeping at midnight. But if it comes to that, there is that flexibility, which I think really allows for those of us who have very limited time to get the maximal impact and maximal benefit.
As I said, it's the democratization, the leveling of the playing field that's critical in social media.
That's a great way to end. So as we close, any final advice to that woman, lady, someone listening to our podcast and saying, well, I think I want to start getting in on a social media, doing something online. What advice would you give them?
I would say don't be scared to start, dip your toe in. We are a very supportive community. And as Darylyn said earlier, I never thought that I could reach out to people, especially people who are very, very famous or very, very important. And social media makes it much easier to just contact someone. And the worst they can say is no or not respond at all. But I would say I feel similar to what Darylyn said earlier. There's a lot of support and a lot of people who are willing to respond and help in that space. And so don't be scared. We all were where you were. Just remember that my first tweet ever only went to my brother, and he made fun of me and told me I would never have a social media following because I didn't know what I was doing. So we all start somewhere. Just kind of dip your toe in, see what it's like, and reach out to any of us. We're all happy to help.
I agree with that. And I would just add, just be sure you have the appropriate safety checks in. There's a lot of trolling, cyber stalking, identity theft on social media that happens particularly to women and people of color. And I would say just that Impact for Healthcare toolkit is amazing. So just really familiarize yourself with both the positives and how to prevent some of the negative things that happen on social media, and or how you deal with them if they happen to you. Because if you have a big enough platform, a big enough voice, and I think it's important to use our platform and our voices to advocate for the things that we know are right, but that makes you an easy target for folks.
And you can actually find the toolkit that Darylyn was mentioning at impact4hc.com. We created social media toolkit specifically for this. And the other thing I will add that we didn't cover, but I think is incredibly important, is make sure that whatever you're putting out on social media is also in line with your hospital or your institution or your organization. Because what I tell people whenever I give talks on how to engage online, make sure if you put something out, you're happy with your pastor, your friends, your enemies, your parents, your future children, your grandparents, your teachers, your frenemies, whoever. Make sure that you're comfortable with any of them seeing what you're putting out there. Because once you put it out there, even if you delete it, it is likely out there forever. So make sure that you are aware of what your institution's policies are as well, so you don't end up getting in trouble.
I love that my barometer is WWNS. What would Nana say? My beloved mother, that my daughters called Nana for many, many years. And it has to be Nana friendly.
I love that. And one more time, that resource you mentioned that people could tap into.
So the resource is www.impact4hc.com. impact, the number 4hc.com. So impact4hc.com. And you can click on our infographic links, or you can click on one of our resources, which has social media toolkits that can help you navigate this. And it also provides information on other organizations that can help you if you're ever doxxed or attacked on social media, because there are organizations out there that can help with that as well.
Wonderful. And before we end, I do want to just give a shout out to the Women in Medicine Summit. It's coming up, the 13th and 14th of September this year at the Drake in Chicago. Darylyn, I don't know if you're going to also be joining us. I will be there. I know Shika will be there. It is such an incredible opportunity. So mark your calendars, put that on there. If you've enjoyed this podcast episode, there is tremendous information shared at that summit. So I want to thank you, Shika. Thank you, Darylyn. Such a pleasure to talk with both of you. And should I say happy tweeting or happy Instagramming or leaning in? I'm not sure what the correct thing is, but I wish you both a great rest of this month and this year.
Thank you.
Thank you so much.
Thanks for joining us. Tune in next week as we continue our journey to amplify the voices of women leaders in pharma and medicine. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next week, remember to lift as you rise.